Hello, welcome to IVFadviceonline.com. My name is Dr. Glenn Sterling. Welcome to sunny Queensland. I'm an IVF specialist and I own an IVF clinic called Life Fertility Clinic in Brisbane, Australia. I've set up this website because I know that many patients want a second opinion with regards to their infertility treatment. Many specialist ONGs or OBGYNs are able to practice IVF and infertility, but it's not their area of expertise, and often they have little experience in the field. Some people practice mainly obstetrics, other people practice mainly gynecology, and when they see a patient for infertility, they're prepared to have a go at it with basic understanding. This area and subspecialty is becoming more and more complex every day, and as such, I think it's our responsibility to inform people that IVF and fertility treatment is a lot more complicated than what might otherwise be offered by less experienced clinicians. Some patients attend subspecialists and simply want another perspective on their treatment. There are a lot of good specialists in most areas where IVF is practiced, but some people just become so desperate that no matter what, they want another opinion and another perspective. And often with my patients, I'll ask for another specialist who I trust and who has done a lot of IVF to give an opinion, just to perhaps offer another a view on a particular case that we're having not much success with. We're not here to pinch patients from other IVF clinics, but to give you written advice that may assist you in your current specialist and your specific issues. So often, even the basics are missed with specialists that dabble rather than devote their professional life to IVF. We want you to have the lowest cost, emotional, physical, and financial in your journey of treatment. All that we require is your history and your treatments, so that within a week we'll reply with a written suggestion of how you can focus your treatment to get pregnant as soon as possible in the least costly way. We don't want to recruit you into our IVF program, but simply to give you advice based on years and years of IVF experience. I'm a fellow of the Royal Australian and New Zealand College of Obstetrics and Gynecology. I'm an IVF specialist. I don't deliver babies and I don't do much general gynecology. I do IVF. I've been working in the field for 32 years and I love it. I'm the founding medical director of Life Fertility Clinic in Queensland, Australia, and I have founded another IVF clinic prior to starting Life Fertility Clinic, also in Brisbane. My specialist training was in Harley Street in London, under the tutelage of Professor Ian Kraft at the London Fertility Centre, before I returned to Queensland, Australia. It's important to understand that Australia is at the forefront of the global IVF industry. We do well to remember that many firsts have occurred in Australia in the field of assisted reproductive technology. The most basic of these was the first IVF pregnancy in Melbourne, Victoria in 1973, nearly 5 years before the first IVF baby, Louise Brown, was born in the UK. Australia pioneered embryo freezing technology with the first baby in the world born from frozen embryos. Aussies are at the forefront of IVF, and here's why. Australian clinicians have an enormous wealth of experience in IVF compared to most doctors practicing IVF in the world today. For comparison, Australia and New Zealand clinics, with populations of less than 30 million people, managed 71,500 cycles of IVF in 2013. This data was only released in September 2015. With a population of 322 million, one might reasonably expect that in the United States, IVF clinics would do on the order of 750,000 cycles per year on a relative basis. But no, in the whole of the USA, only 150,000 cycles occur each year. Interestingly and recently, an expert from the States was on a lecture circuit in Australia and admitted to doing 150 cycles per year. We do those numbers on a good month. This places IVF Specialists Australia in a commanding position to offer opinions in the field of assisted reproductive technology that not many others can. So here are a few tips for those of you that are struggling with IVF. They are the same as those that I would offer my family members. Firstly, does your doctor do obstetrics and deliver babies? If he or she does, they're not really focused on IVF, and you might want to consider your options with regards to treatment. Secondly, how many cycles does your doctor do per year? If it's less than 200 cycles, head for the door. Thirdly, how many major professional meetings has your doctor been to over the last year? Look for meetings such as the European Society of Human Reproduction and Embryology or the American Society of Reproductive Medicine, or national meetings in Australia such as the Fertility Society of Australia. Let's get it clear. This website and the services we offer are not here to drag you away from your doctor or IVF clinic or to jump ship. We just know that there is upwards of 80% of patients that see IVF specialists, in inverted commas, that have less experience than we would consider adequate to deal with complicated IVF cases. Does it hurt to get a second opinion to ensure you are getting the best treatment possible and as cheaply as possible? Don't forget, cheap means cheap financially, cheap physically, and cheap psychologically. And the last one is probably the most important, psychologically. And so I'd invite you to share your medical history, securely of course, and let us guide you clinically to get you out of the IVF clinic as soon as possible and into the labour ward. Our personal advice will be enlightening, I'm sure. I'd invite you to complete the attached questionnaires, and within a week I'll send you personal advice as to options that you may wish to consider. I wish you good luck with your treatment. I hope this chat has been of interest to you, and don't forget, everyone can have a baby. It might not happen the way you think, but it can happen. I bid you farewell, and hopefully we can be of help to you.